There we go.
Yeah.
Okay.
Okay.
So what do you think the best way to do this is? We could like me and Abby were talking and we were saying that we could talk about our information and like how we want the PowerPoint set up, but then like you guys could just send us your information and we could put your information onto the PowerPoint just so it's like faster now.
Yeah, I think that's better.
Yeah.
Would that
We just send our information.
Okay, because we could talk about like how we want to set it up within the PowerPoint, and then we can also like we're gonna meet again to record it, right?
Mm-hmm.
Yeah, for
So
the
then-
presentation.
What?
For the presentation.
Yep.
Right?
So then we
Yeah.
can like meet again, and if anything's wrong with the PowerPoint or like you guys don't like the way that it's set up, we could just change it then and then record.
Yeah, I think it's okay.
Yeah.
Let's see. So do we want to just like go back and forth? Like one of us will say our answer for the first question, and then the other pair can, and we'll just move down.
Yeah, because
That works.
that works. Yeah.
Okay.
Kind of like comparing and contrasting. Is that what you're saying, Liz?
Yeah.
Okay.
So just so we can like we'll each read our personal answer to one part, and then the other can read their answer to one part.
Yeah. Okay.
Okay.
Yeah, okay.
Well, I did like the first part, so I can read my first answer when you guys asked what is your definition of alcoholism in your country, and I found alcoholism is the most serious form of problem drinking and describes a strong, often uncontrollable desire to drink. Sufferers of alcoholism will often place drinking above all other obligations, including work and family, and may build up a physical tolerance or experience withdrawal symptoms if they stop.
Yeah.
So
No,
it's a lot. It will be easier. I think like it will be easier to compare and contrast once it's on a PowerPoint and stuff. I'm sure
Yeah.
the definition is similar for you guys. It just depends where we got the definition, you know?
yeah, I think that's true because I had the same definition.
The exact same one?
Yeah, actually, I had you're an alcohol addict when your body can't function properly and without the alcohol.
Okay, so you just talked more about the withdrawal, but otherwise it's pretty similar.
Yeah,
Okay.
but we have stages of alcoholism,
Okay.
and the first stage is that people do get a higher tolerance for alcohol, and people drink a lot and try to hide this for others. The second stage is that people do get an urge to drink, get blackouts, and aggression is a common occurrence. The third stage is you lose control of your alcohol use. Your work and social life suffer from the alcohol addiction. People are getting confronted with police and judicial in this stage. And the fourth stage is total dependency of alcohol. Withdrawal reactions do occur in this stage. The impact to the body is also visible in this stage. People do get memory loss and all that kind of stuff.
Okay, yeah, so I think we basically have this same thing, but mine's just kind of conjoined together and yours is more spaced out. So put it on the
Mhm.
PowerPoint. Like, I don't know, Abby, how did you kind of outline it right now? Or you just
I
put
just outlined. I put mine in PowerPoint format just to be easier to read, and I just did because I did the treatments, and there's like 3 types of treatment, so I just did 3 slides for each type,
Okay.
and then like explained what each type was and like what it entailed and stuff, and then so you could do a slide on the 3 stages and just say like stage A, B, C, or whatever they are referred to as.
So
in the
then how
same-
go ahead.
Oh, in the same dia, in the same slide.
Slides.
Yeah.
Yeah, like I
Okay.
think that because they're not like super detailed, so I think we can just do like a slide explaining the European side and then a slide explaining the American side because it's not super detailed. Whereas
mean
with
like-
treatments, they're really detailed.
Okay, so you mean like each stage on like or on the same slide?
Yeah, if it looks good, I guess. I mean, I don't
Well,
think it matters.
yeah, I
Like,
mean, well, we
just
can
need
figure
to,
that
like,
out and
fit
then
on a
okay.
slide.
Yeah, well, once we get their information, we can do that. But then, like, so are we just gonna, to compare and contrast, are we just gonna do like US on one side or 3 sides, whatever, and then the next side is going to be like Netherlands or something?
I think so.
Yeah.
Okay.
So,
So
like,
then,
keep each topic together, but then like 2 sides.
yeah.
Okay, I think that would look good.
Okay.
Me
So we can like try and set that up and send it to you guys, and you can like change whatever, and then we can also talk about it before we record. Does that sound good? But that's the idea we'll go for when we make it.
Yeah, nee, that sounds good.
Okay. Okay. So then the second question we had was, what are the most common causes for alcoholism? And I found that family with a history of alcoholism, people trying to improve their moods and spirits, they're drinking to forget their problems, depression, peer influences, and undereducated adolescents.
Yeah, I had almost the same. I had also a lot of stress and childhood traumas,
Yeah.
and
Yeah, it's hard because
personal-
like a lot of our things I think overlap, which is fine, but like it just depends where
What
you
is the
look for
difference?
it, because the stuff would still be the same for
Yeah.
us. Like the childhood trauma and that kind of stuff would still be a cause.
Sorry, I don't want my dog out.
That's okay. Okay.
He's trying to be discreet. Okay.
Yeah. That. And we could even like indicate that in the PowerPoint, like, you know, the research we found said this, research you guys found said this, but there would still, like, those would still be causes of it. The places I looked just didn't specify that, you know?
Yeah, I know what. Yeah, I think the causes are almost the same in the Netherlands and in America, so we
Okay.
can say that it's the same. I think
Okay.
in the PowerPoint.
Okay, so then, sorry, do you have more for that question?
No, I want to say, do you agree with that, or do you want to?
Yeah, I completely agree.
Okay.
Yeah. Okay, so then how do people react with alcoholism? So I said that there's a lot of stigma. So I don't know if it's called that there, but people get labels. They're labeled as dangerous, immoral, blameworthy. And when they're labeled those things, a lot of times people avoid getting treatment or acknowledging their problem. The stigma here said it was significantly higher for men and people with a lower income, lower education, and individuals who were previously married but are not married anymore. Sorry, hold on. Yeah, people with alcohol disorders who had high stigma from other people, so a lot of labels that people were labeling them with, they were less likely to get alcohol treatment services. There is not as much stigma for women as there is for men, and there's more social empathy for women. And I just found that families also impacted because of their loved ones, and a lot of times they start to drift from them, and some of the family members or friends may also become afraid of the alcoholic in their family or friendship.
Okay.
So you can go. Sorry, that was kind of a lot.
Yeah, I don't have a lot. I have
Okay.
that most people ignore the behavior of an alcohol addict. When you see someone on the streets, I think you ignore the behavior. Yeah, and we also have stigmas.
Okay. Yeah, so that's just, yeah, we can acknowledge that too, because there's definitely, like, yeah, with avoiding treatment, that would be kind of ignoring it. So,
Yeah.
The next question you had about it being a taboo in your country to tell about your alcoholism, I honestly just said no, because of everything that I had in the previous question about the stigma and how that makes people not want to talk about it and like get help. So we don't talk about it unless, like, you know, they're accepting that they need help. Otherwise, people don't really address it.
But
Sorry?
I feel like that's also like it's not taboo. Like people do talk about it, but it's like a personal choice to talk about it. It's not like the whole country says no, we don't talk about it. So it's like not a taboo, but it is a taboo in a different way.
Yeah, I get what you mean if you look at it that way. Yeah.
Yeah, I had people normally don't talk about the alcohol problems to people. They also don't go to the doctor with alcohol as their problems, but they come with other problems like physical problems or other problems.
That's true.
Sorry?
If you look at it like that, that's true, because a lot of people, once they start to have health issues, they'll go in for that, but they don't acknowledge the alcoholism.
So, yeah, sorry, my books fell off the...
Sorry, I didn't even notice.
Can you say that again?
I just said that that's true, that a lot of people, they might not acknowledge it at first, but then once they have health problems, they would go in and seek help for that, and then maybe be more likely to, get help. Yeah,
exactly. And doctors find it also difficult to start a conversation and ask people about any alcohol problems. But more and more people are trying to stop this, and they want to do that by means of guides. So for doctors, they are trying to, wat is maken in het Engels? Make guides for them so they can easily talk about alcoholism with other people, with people with alcohol addiction.
Okay, good. Yeah, that's a good other way to look at it too.
Mm-hmm.
Okay, so then Abby, I don't know if what we were doing was splitting this up, but I did stuff for this question, so I can say what I found. So I did the prevalence. So there was like a survey, and it said that 86.4% of people ages 18 or older reported that they drank alcohol at some point in their lifetime, which isn't alcoholism, but just how prevalent alcohol is. And then 70.1% reported that they drank in the past year. 56% reported that they drank in the past month. And then 50.9% of people age 18 and above are regular drinkers. 13.6% are infrequent alcohol drinkers. Overall, 23% of adults age 18 and above drink more than 5 alcohol drinks in one day. Almost 60% of men are current regular drinkers. So, yeah, that just was like the prevalence more of for alcohol.
Okay. You know that.
Sorry, I didn't hear what you said.
The facts and trends. That question.
Yeah.
Okay. Now I found in the Netherlands, men drink more than women.
Yeah.
8 out of the 10 people drink into old age. Adolescents start to drink later than a few years ago. A few years ago, people started with around 14, 15. And nowadays it's about 16 and 17 people start to drink. In the Netherlands, the beer consumption is the highest. After beer comes wine, and after wine comes spirit drinks. When you look at all the addictions, alcohol is the biggest problem. And alcohol costs the society 2.9 million euro. Police and road accidents and health costs. And I found also how do you say that?
Statistic.
Yeah, statistic that excessive alcohol use is most common between the age of 20 and 29, and the fewest of the lowest in the age of 30 and 39. And yeah, that's actually what I found.
Okay, I think that one of the differences, like I could look up more in depth with it, is the starting later, like how it used to be earlier and now it's later. I feel like here, I don't know, Abby, but I feel like I mean, yeah, if you look way back, like our law used to be 18, so it did get older to 21. But I think that a lot of people start earlier in high school than probably back then because it was legal earlier.
Yeah, I guess I agree. Like, people are starting before the legal age now versus they weren't as much when it was younger.
So we could
Is
look
the
at
legal age? Oh, sorry.
Oh, the legal age is 21 here,
Okay,
Okay.
here's
but it used to be
18.
18 back in like, I don't know,
a while ago.
the 1920s or something like that,
So your
100
guys
years
is
ago.
18, right?
Yeah, for
Yeah,
us
a
it
few years
was.
ago it was 16.
Yeah.
Okay. That's so weird. 16 seems
Yeah.
I know.
That's funny. Okay. Yeah, so we could put that in the PowerPoint too, just because that's like a difference between the legal side of things, and we just
Mhm.
know that. We don't really
Yeah.
have to cite that, I don't think. But
Yeah.
okay. And then what else? I thought there was something else you said. Maybe I'll think of it when you send us.
Maybe
Okay, yeah.
is the beer consumption the highest in your country too, or is it more like spirit drinks and that kind of stuff?
Yeah, that was the other thing. I don't think that wine would be the number one choice here. I feel like it would be
I
like,
think it's like hard liquor.
yeah, I do too, but I can't think if it's rum or vodka.
No, I don't know which one it is, but it's definitely not wine.
Yeah, it's one of those two. So we could look that up too, just to make sure like there's another like different. Yeah. Okay.
Okay.
Interesting. Is this me, Abby?
Support.
Treatment, inpatient and outpatient.
Oh, I did that.
Okay. Well, I have stuff too, but we'll just you say yours, and then we'll just compare and see if any of mine compares
Did you
better
do
or something
support?
later. Oh, where is that?
Well, it's support for patient and family and impact on patient and family. But I looked it up with treatment because they're kind of like combined.
Yeah, that's what I think that's what I have within
Okay,
the
that's what I did
treatment
too. So we'll just kind of present it together then.
Okay. You can just present yours, and then I'll just like look further into mine when we get their information, and we can compare it better.
Okay.
That work?
So for treatment, a lot of treatment is like, it doesn't like you start and then you go to the end. Like, people go back and forth a lot. So a lot of treatments are like combined multi-types of treatment for patients. So there's alcohol detoxification when you're drunk and then you become sober, inpatient rehab, and then alcohol counseling. And they all kind of deal with like support as well. So alcohol detox is the medically managed detoxification, including medical benzodiazepine management to minimize withdrawal symptoms. And then the medical detox program takes place in an inpatient center or a hospital where a medical team provides supervision and support around the clock. And that's in the like beginning phases of recovery. And then there's inpatient rehab, which the purpose of inpatient rehab is to prevent relapse in the time following detoxification by accommodating the physical and psychological needs of clients. So they provide intensive treatment to develop life skills outside of addiction as well. So they manage withdrawal and relapse, as well as like how to move forward with your life and get a job and stay sober, and how your family can help you move on through that too. And then there's alcohol counseling, which counselors offer guidance and support during the treatment and recovery phase, and they can assist patients, loved ones, and families in the transition. They use a treatment plan designed for each patient and monitor the progress over time. And they're a way of support for inside and outside groups. And the outside groups are like Alcoholics Anonymous. And then there's Alcoholics Anonymous for alcoholics, and then there's for family as well. And yeah, that's all I got really.
Okay. A lot of information.
Yeah, I know it's kind of confusing because there's different pieces.
Now I found you can go to the Um, okay. The best known treatment to get rid of your alcohol problems is to go to an alcohol clinic. I think that is almost the same as detox or what you said.
Yeah.
What do you mean by clinic? Just like, do you know what they do? Because I think,
I think
Yeah.
that
is that
Go
kind of
ahead,
like the
you explain.
detox, or is it? Sorry.
Yeah, I don't know it for sure. Debbie, do you know how to explain it?
Is it like a
No, a clinic
counseling?
for.
Yeah,
You
it's
have different
actually
ones. Sometimes
yeah.
you are living there in the clinic, and sometimes you go there twice a week or something.
Okay.
It's
okay. So
about
that's more like rehab for us.
when you live
That's
there.
like
Is
the
that
inpatient
rehab?
rehab, I think.
Okay.
What is rehab, Debbie?
Is rehab that you live in a clinic and yeah.
That's when they like
you
teach you to do life without alcohol.
It's
don't
like
know how to-
counseling. Do you know what counseling is? So it's
no.
No.
talking to someone to, I don't know, free your mind or think better about
Okay.
and more positive. Like,
Yeah, then we have self-help groups, I think. The people talk
Okay.
about their problems to other ones and then help each other out with their problems.
mhm.
I think
Okay.
that is counseling for us, or with a therapist.
Okay.
But I don't know for sure if there is detox, but I think so. Maybe I can look for it after the meeting.
Okay.
You also can get online help. There are clinics who are offer online help. You can go to the site of an expert that wrote that, and you can read how to stop the problems and try it first by yourself. Now you have self-help groups. People who have an addiction can share their story with each other and help each other out. And we do have anthropological, and that if you want to go there, or if you believe that, you can go there. And when you look at treatment, we have behavioral therapy. Two things are central: to change someone's behavior, and the therapist tries to change your way of thinking, because most of the time the way of thinking has been disturbed, and they try to change that in the clinic. And this is a very intensive treatment, and people stay there for a very long time. It depends on how people react to this therapy. We also find 12 steps program. They also call it the Minnesota model. Like, I don't know if you know this therapy.
I don't think so, but if it's Minnesota, we probably should.
Yeah.
I thought so too. But it's a group therapy where people talk about 12 teams. First, it was thought that you have to be religious to take part in the therapy, but it isn't anymore. The key elements in this therapy are you admit that you have a problem, you are willing to get help from others, you are fair about your progress, you are in an environment in which you can trust people, you are willing to change, and you help others to get rid of the problem. So it's actually also a group therapy.
So is it something that happens there, or do they come to Minnesota for it?
No, it happens here also.
Okay. Okay. I was just
And-
curious. I don't know.
Yeah.
That's weird. I never heard of that at all.
Me either.
Okay, I read that it was all the most famous of the most
Most used?
most used therapy in the world.
Okay. Interesting. Maybe it's just not called that since we're from here. It's just like the way that they do it. I don't know.
Yeah, maybe. Yeah, I don't know. I thought maybe because there was a Minnesota model, maybe I thought you would have heard of it.
Well, we can look into it too, but I've never heard of it. That's funny.
Okay. And actually, a lot of aid workers learn motivational talks that is the aim is to start behavioral change through development of motivation. And yeah, actually every aid worker in his work learns to do this and help people to motivate. That's actually what I found.
Okay. Yeah, so I think like it's just for treatment, there's so many different things that it will help when we get your guys' information so we can read it and kind of compare and contrast more closely, because I think a lot of it's similar. It's just different terms.
Yeah, I think so too. But maybe we can look at what is most common, what is most used. Then maybe we find a difference.
Okay. Yeah, you could do that.
Oh, you mean what is the most used treatment form?
Yeah, in America and in the Netherlands. Then we can see what the difference is in your country and ours.
Okay.
Yeah. Okay. And actually, that was my piece.
Okay. I feel like for that, like we can definitely do that for the most used, but it might be hard because I think it depends how much they're struggling with alcoholism, because detox here is like pumping their stomach and getting the alcohol out of them after they binge drink or drink a lot. So, and then it just depends like what kind of treatment they want, I think. It's hard to put a finger on what's most used, but we can see if it, pops up when we look it up.
Yeah, because I know for us, if you go to detox, or if you're in the hospital detoxing and you're being like given medications, it's not really, it's like required. It's not like you voluntarily say, I need help. But then if you go to inpatient rehab, that's like you're asking for help. And I don't think a lot of people do that or do it multiple times, but people have gone to detox multiple times. So I think it's like hard to determine what's the most used.
But we can still put still compare and contrast the different things that you mentioned and that Abby mentioned, and then we can try and look up the Minnesota model and see if that comes up here, because that's something that probably should, but I've never heard of it.
No,
I wonder though, because we have like 3 of the best like inpatient rehab programs in Minnesota. I think that's probably where they're like based off of.
That's what I was thinking. Like it's not necessarily called that here, but since we have such good programs here for it, other people use it and give us credit for it, maybe.
Yeah.
But I think that it's my fault because I searched for only search for therapy that is for people that have longer that are longer.
That's okay. I mean, that's like just what you're gonna get in the differential of like researching. We're not gonna have the exact same information. I don't think they expect us to. It's just comparing what we can, or that's what I.
Okay. Yeah. Okay.
Because we still had specific questions. Like you guys did a good job of outlining that. It's just obviously we're gonna find different information.
Yeah, it's hard to get the same points.
Yeah. Exactly.
Mm-hmm.
Okay, so which one are we on now?
Support for the patient and family.
Oh yeah, support.
Okay.
So for us, a lot of the treatment is like counseling or therapy, and they always have individual and like family therapy. So that's kind of like the biggest support system out there for treatment wise. And then Alcoholics Anonymous, there's a version of that called, it goes by Al-Anon, and it's for families that are dealing with alcoholic loved ones. That's all I found. I don't know if you found more, Alyssa.
Yeah, I have like the helpline and stuff, and then I also have, I have what it's called and everything, and like how long it's open. And then for support, I did like from a family or friend perspective. So it's not really like a professional way, but it's just talking about how to help someone, like learning about it, offering support for the person to make positive changes, and such as choosing not to drink, express love when you're talking about the concern for them, offer help and offer to help them find treatment, know that the person can't just quit without help from addiction specialists, know that recovery is an ongoing process, set clear boundaries. Yeah, so that's just talking about like as a family member or friend. And then I have found something about attending a family therapy together with the person who's struggling with alcoholism, just because it can put strain on family members or partners. It can help heal those family relationships and rebuild trust if they go together. So that's kind of what I had.
Okay.
I found here the family may be confronted with a situation and sad, angry, or guilty, and also powerless. For these people is also help. In the Netherlands, there are different kind of relatives groups where the family of the patient can talk and support each other. Also, they get information and advice about how you can deal with the situation with the alcohol addict. On the internet, there are also different sites with information about conversation tips and tips for yourself, how you can handle the situation. At some clinics, there's also a family trust person. If necessary, they can mediate between the family and the care providers. If there are issues concerning the treatment, she can also support you filling in a complaint. That's what I had here.
Okay. I just thought of this. I thought that maybe like when we make the PowerPoint, or Abby and I, we could like, we'll get your information, and then if we see something that's different, maybe we could change the text color to like red or something. So then it's just like obvious what's different between our countries to other people, when we're giving it. I mean, we can
I think that's a great idea.
Yeah, so then it's just more obvious, and it's more compared and contrast with a color. I don't know.
Yeah.
Yeah, I think that's a good idea.
Okay. And then
medical issues.
Okay.
So the 3 questions that we had were the first one was what kind of medical issues are most common? So a lot of the research was saying that like, because alcoholism, like alcohol affects your whole body because you like drink it and then ingest it and digest it and metabolize it and excrete it. So it goes through the whole body system. So it basically can damage every organ in your body. But a lot of the leading medical issues associated with it were heart disease, hypertension, which is high blood pressure, liver failure, liver cirrhosis, liver cancer, pancreatitis, cancers of the mouth and digestive system, and then neurological issues, so memory loss, confusion, balance issues, things like that. But the leading medical issues with alcoholism were liver cirrhosis, and it affected 633,000 people annually, which it also said that liver cirrhosis was the leading cause of liver cancer. So then a lot of those progressed to liver cancer. And then it also is the leading medical issue with preventable injuries, like accidents and stuff like that. So that was 500,000 people were affected by that annually. And there was something else I was going to say about it. Oh, that was on the other slide. Never mind. Yeah. So if you want to talk about that, okay. And then I was going to do the like incidents afterwards if you wanted to talk about your medical.
Yeah, okay. I had something the same, but the most common alcohol diseases are cirrhosis of the liver, cancer, alcohol poisoning, and also I had Korsakoff. Is that also there? But Korsakoff?
I feel like I've heard that. I don't know what that is.
Tycho, do you know how you
Korsakoff is actually also
A sort of dementia.
Yeah,
Oh, okay, yeah.
Oh.
That's what
memory
okay.
loss.
I
That's
forget.
what
That's what it's actually
neurological
called.
issues are that she was talking about. Neurological is brain or memory
Yeah.
issues.
Yeah.
Yeah,
Okay.
I forget that's like the dementia of alcoholism. Okay, that makes
Yeah.
sense now.
Yeah,
Sorry.
okay. And Korsakoff is about 8,000 till 10,000 people in the Netherlands has Korsakoff. And about the cirrhosis of the liver, 4.4 people out of the 1,000 people has cirrhosis of the liver. It's not clear whether the cause of this is alcohol or something else, other disease, but I couldn't find that on the internet.
Yeah, that's what mine said too. It was kind of iffy on what was causing it.
Yeah. Also, I had a statistic, but we can maybe do that in the PowerPoints.
Yeah.
Okay.
Sorry, I was just like, I'm prepared, but I just didn't say anything.
I heard a bird at the background.
Yeah, that's what I had here. And then the incidence. Cirrhosis of the liver is 0.6 people out of the 1,000 people per year. And alcohol poisoning, 1.9 per 1,000 per year. And about Korsakoff, the incidence of Korsakoff cannot be reliably determined because the poor accessibility of the risk groups. So I couldn't find it on the internet what the incidence of Korsakoff was. And about cancer, 3% of the cancer mortality and 2% of the cancer incidence is because of alcohol. That's what I...
Yeah, I feel like it's just hard to find statistics on that because some of it could be from alcohol and some could be something else. So, but yeah, I think what we both found is similar, especially with the cirrhosis. I think that's probably the biggest one, or like most life-threatening that it leads to.
Okay.
Yeah.
I had some statistics as well. So it said that 27% of adults in the United States admitted to engaging in heavy drinking during the year. And the comment after it said that not a lot of people will admit to heavy drinking or having an issue. So it's kind of skewed. They estimated that it's at least doubled in the statistic wise, because people won't say that they're heavy drinkers. And then alcoholism resulted in 88,000 deaths annually from all different types of diseases revolving around it. So it was the third leading cause of preventable death here in the United States.
Okay.
So it's kind of prevalent, I feel like, from that issue. But then, yeah, my statistics were just that liver failure or liver cirrhosis was the leading medical issue with. It didn't really give me 1, 2, 3. It just was liver failure is a really big deal.
Yeah, I had the same.
Okay.
It's hard to find on the internet.
Yeah.
Okay. Well, it sounds like we have a lot of similar things, but then I think the biggest things would be the type of alcoholics drink, and then our age, what's legal and when people start. And then wasn't there one other thing for sure that was
the types of alcoholism, the stages.
Oh yeah.
And the types of treatment used most often used or more prevalent.
Yeah.
But don't you think that we have the stages here, Abby?
I don't know. I tried to figure out, I was kind of looking for that and I didn't really find it, but I wasn't looking.
Okay, so maybe it's just more general here. There's not really stages.
Yeah.
Okay. Well, yeah, we can definitely look at that. And then the Minnesota model would be interesting to see.
Yeah, that would be cool to look at.
Yeah, and I
Yeah.
will search for the detox in Netherlands.
Okay.
Okay, so should we just, so you could look up the detox there, and then was there anything else? I don't think so.
No, I don't think so too.
So then, yeah, you could just see if like that's a thing there, and then email us your information. We can put together a PowerPoint, email it to you. You guys see what you think about it, and then we eventually will meet again and present it.
Yeah, I think that's a good idea.
Yeah,
Okay.
it's good.
That sounds good.
Okay.
But in
Anything
the
else?
next meeting, we should introduce team members, the brief presentation of the case study, the discussion, the main points discussed in part 5. So, yeah, what we just discussed, and then the conclusion. I don't know what they mean with conclusion.
I think we can just say what the major differences and comparisons we found were, and we could also, like, when we make the PowerPoint, we can put, like, we'll put an introduction slide maybe, and then we'll put points like introduce ourselves and then introduce case study. So then we're reminded of that when we present it, and then we can also make a conclusion slide that we can summarize the main differences or comparisons. Would that work?
Yeah. I think that's
Okay.
cool.
Okay, perfect. So you'll just try and get that information to us so we can put something together for the final one?
Yeah.
Okay,
Yeah.
But,
sounds good.
Perfect.
I'm first going to search that
Yeah,
more information, and then I'm gonna send it to you.
Okay.
yeah, that's perfect. I'll send you guys the link of the broadcast too, of the recording.
Yeah, okay.
Okay.
That's great.
Okay,
Okay.
thanks for meeting with us. Good luck on your tests.
Yeah, thank you.
Yeah.
You too.
Thanks, guys.
You
Thank
too.
Talk to you
Bye.
later.
Bye.
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 Bye. Okay.